Good afternoon. Welcome to another episode of Get to Know Them. I am delighted to have you here with me today. For those of you who may be tuning in for the very first time, my name is Monica Graves. I am your host, and I broadcast live from my jewelry studio every Tuesday at 1 o'clock here on Facebook Live. And I started this podcast when COVID first began because it was a dream that I always had. And the whole mission of the podcast or the YouTube channel, depending on how you're listening or watching, is to really introduce you to inspiring people that I know so that you can hear their stories and walk away feeling good and inspired yourself. So I'm very excited to have you with me for the next 45 minutes to an hour. And our guest today, oh my goodness, a lot of you know our guest and are very excited to be watching. And I'm so excited to be chatting with our guest. But before I introduce you to our guest, I'm going to just briefly go over our show sponsors. So the first show sponsor we have is Brenda Bedome. She is a very talented clothing designer based out of Toronto, Ontario. You can check out her website at brendabedome.com and use the coupon code Get to Know Them for 20% off your order. The second show sponsor is a place a lot of you guys know because we meet there Thursday nights for roller skating, and that is Scooters Roller Palace, located in Mississauga, Ontario. Their website is scooters.ca. If you are thinking about maybe getting back into roller skating, they do have lessons at 7 p.m. on Thursdays. I highly recommend you take them. They are fantastic, and they will have you out doing loops around the rink in no time. Our third sponsor is located in Oakville, Ontario, flourishandbasque.ca, a lovely little shop with a wide assortment of alcohol-free beverages. So please make sure to check those out. Now that the weather's getting warmer, you may be craving a pina colada or something refreshing like that, and it's nice to know that there is an alcohol-free option if you choose. And last but not least, I also sponsor the show with my jewelry collection, Glam Jewels, spelled GLAMJULZ.com. And as I said, we're located in Burlington, Ontario, along with creating custom pieces for women of all walks of life. We also do a tremendous amount of fundraising. So if there is a cause that you believe in where you want to raise money and you want to do it in an easy way that is cost effective for you, please reach out to me. I would love to work with you on a fundraising project. Okay, are you ready? Let's not wait another second. I cannot wait to introduce our guest to you. Dr. Alexandra Ginty is with me today, and she's patiently waiting backstage while I pull up her bio. I'm going to read it to you. Um, this is just so awesome. I'm so excited. Okay, so Dr. Ginty has become the first physician in Ontario to perform areola tattooing on post-mastectomy cancer patients. As a bilateral breast cancer survivor, BRCA carrier, and physician, Dr. Ginty realized the mental health impact as a patient and a physician in the areas of both compassion and advocacy. Having a background in art, Dr. Ginty knew this was her calling. The only question was, how would she get someone to teach her to, to believe in her being a tattoo artist, in being a tattooist, and take her on a journey that required about 200 hours of training. For Dr. Ginty, art therapy was the way that she psychologically healed from her own cancer experience. Today, Dr. Ginty is providing her service at the outpatient medical surgical clinic at Oakville Trafalgar Memorial Hospital, where she is a family physician and surgical assistant. In this interview, Dr. Ginty will share her procedure with us as well as her personal story, including how her patients' lives have changed as a result of her pursuing this very important step of the restorative phase of life after breast cancer. Let's bring her on. Dr. Ginty. Yeah.
Hello,
So
everyone.
it's so exciting to have you. I want like confetti and balloons. Woo. Yeah. This is so
Welcome to my
cool.
lovely room. See,
Yes. I love it. So, Dr. Ginty, as I was saying when we were getting ready backstage, the first question I'm going to ask you is what you wanted to be when you grew up, because that's where I always start. But before we go there, I just wanted to share a short little story with you. So, a mutual friend of ours introduced us via email and we set up this interview. But I just found out yesterday that had heard about you about 5 years ago when my dear friend Karen Baring came to you to do art classes with you and learned how to do the mandalas. And she continues to do that. She's been doing them every month for 5 years because of you. And then I was super flipping out yesterday because I'm like, mandalas, circles, eclipse, areolas, like all of this. It was just like so magical. And I feel like, oh my God, like I have goosebumps right now that you're here on this day, the day after the eclipse. And this is what you're doing to serve humankind. And I'm just, it's amazing. The
yeah,
universe brought us together.
I do think there's a relationship between Mandelas and areolas. I do. I think there's
Yeah.
something in that. Yeah, yeah, yeah.
Yeah, so cool. So let's start with the first question then. What did you want to be when you grew up?
That was easy. I did want to be a doctor. I did. I didn't want anything else. And I even was when I was a teenager, I actually worked in a nursing home as a what they call a nursing aide, and we did a lot of the basic stuff. And they said to me, "Oh, so you must want to do this when you grow up." And I said, "Oh, no, no, I want to make the decisions." So, so I always did want to be a doctor. I always wanted to make the decisions. I just thought it was too hard. Um,
Right.
but that's where I think you create resilience in
Mhm.
wanting to do something with all your might. I don't think
Yeah.
I really thought it was possible until I was in university. And then I realized that I not only absolutely loved everything that came in front of me, because now it was all biomedical, but
Uh-huh.
I really, really felt that academically I could get there.
Wow. So something really clicked while you were
Mm,
at school and going.
mhm.
And so this is something I'm always curious about. Like, what was it like the very first time you actually had to treat someone? How did you feel in that moment? Like, do you remember the patient and
I don't
how that
really
felt?
remember like one episode per one specific episode.
Yeah.
But when I graduated, we were allowed to do something called moonlighting. So
Okay.
we just did an internship 1 year, and then while we were training, I was doing family medicine and I did emergency medicine. You could still work. So off we went
Okay.
to rural emergency rooms, and everything came in. We were so unprepared, but honestly, gunshot wounds, bow and arrow, you name it, came
Wow.
in, and there would only be one of us, and you had to rely on really good nurses. Yeah, anything and everything, and it was a little bit fly by night, but it was excellent training, just excellent.
Yeah.
I
It,
specifically remember really tough cases, of course, really tough
right.
ones, especially explaining to people that they were going to die or their relatives were going to die. Those do stay with you.
Mhm.
Those will always be parts of you.
Yeah, I'll bet. My goodness. Yeah, you were thrown into the trenches, it sounds like.
Yeah.
Yeah, wow. And so you became a family physician, and was that sort of where you saw yourself in medicine, that you were going to be a
You
family
know,
physician, or
that's the funny thing is I am I love everything, and I love change. So, and I think that's where art comes in, but in family
Yeah.
medicine, you don't know what's coming through the door. When I trained, I wasn't sure what I wanted to do. And actually, when I was in family medicine, the preceptor I was with, I didn't like it at all. It was a very old practice and it wasn't stimulating at all. And I thought, absolutely not. I'm going to be an emergency physician. They said, it's really hard. There's only one spot. And I said, and I always teach my kids this, I only need one spot.
Oh my God,
That's
that's
that's something you
awesome.
always have to keep going with. Oh, it's really hard. There's only one spot. I only need one spot. You know, so yeah. So I got into emergency medicine, and I loved it. Absolutely loved it. But it didn't match well with having a family, working night shifts, and not having a family to support my kids. It
Mhm.
was difficult because my husband's a surgeon, and so I actually went back into family medicine in what I wanted family medicine to look like, which was very compassionate, and I could spend time and do what I wanted with the patients. So I actually did a bit of both. I did some emerge
Mhm.
and some family medicine, and obviously as kids grow and there's demands, a regular schedule is better, and that's where I went out of
Mm.
emerge, just because when they're going to school, yeah, it's really hard. You need some kind of regular
Yeah,
schedule. Um, Even though I was
definitely.
the one tearing in at 2 minutes to 6 because I'd had to, deal with something at the office that was, what we call a doorknob, which means they're just on their way out and they say, what about this chest pain? Do you think there's something,
Oh,
you know?
jeez.
And then I'd be the one coming in at like 2 minutes to 6, and my kids are the only two kids standing there from after school. Yeah, so they always remember
Oh.
that. That's me.
Yeah. Oh
Yeah,
my
before
gosh.
school,
Wow.
after school. That's it. Yeah,
Yeah.
yeah,
And so Dr. Ginty, where did the art come from? Is that
yeah.
something that's been with you this whole time or how?
Yeah, my whole family's very artistic. Actually,
Okay.
my brother does more of a computer type of art. My sister is a graphic artist, and so my family's very artistic. And it was just growing up. You did a lot of art and creativity. My mom's very creative, very creative. So
Yeah.
sewing is actually something I love doing too. I did a lot when I was growing up. So interestingly, so when you do sewing, you have to actually in your mind turn things inside out, upside down, inside out. And sometimes making a sleeve might be folding and then inverting, and there you are. Aha. And I'm telling you, when you assist in plastic surgery, that's something that's very, very similar. Like you think, oh, it's the sewing, which yes, I love sewing because I love to merge, but the whole idea of creating something and turning it into something else is
Right.
something that I really, really love. I'm very pictorial, much more of a photographic memory. And I love anatomy. I did a lot of anatomy in university and taught anatomy. So that's my visual. So you can see why art kind of belongs with me. And then the I did a lot of graphic art where it's all layered.
Yeah.
I do all kinds of stuff where I plan. I've got a laser cutter, and you have to plan the layers. So it's not hard to imagine why the tattooing was something that meshed with all these things. Um,
Yeah.
the technique I had to learn, and that
Right.
was pretty hardcore.
Yeah. Well, I was going to ask you as well, like, with the art that you've done all these years and your upbringing, like with creative siblings and your mom encouraging art, do you think that's what gave you the confidence to say things like, I only need one spot? Was art sort of helping you to nurture that growing
No,
with it? No?
that's an inner strength that's very me.
Yeah,
I'm um, a it, I am very I really take the hard road. I mean, I will
yeah,
push myself hard. If I want something, I do it. You know,
right.
I think that's where this whole restorative tattooing thing came in.
Mhm.
I'll take the risk,
Yeah,
and I'll go the hard road. And I think,
right.
you know, they do say, you know, talent's one thing, but perseverance is what makes
Mhm.
success. It's not just talent. You
That's
can
right.
practice talent, but you absolutely have to have perseverance and the ability
Yeah,
to take risk and know that that you will get there. You
yeah,
yeah, it's that's the perseverance is, and tenacity. I always said was my forte. You know, that was my um, tenacity is something that is really what you need more than.
yeah,
I mean, you need to be. I always say you need to be good enough, but not every
yeah,
artist can do what I just did, like create everything.
yeah.
You know, create
Yes,
a
that's
clinic,
right.
you know, make it possible. Think of how you can reduce costs so that we can have a working website
Yeah,
and a working booking system that comes in with a secure fax line, and put those things together and then present it to the hospital. And
yeah.
and then I knew them because I do leadership with Ontario Health Cancer Care Ontario, done
Mhm.
that for 11 years. And so I knew a lot of those people in the more
Right.
leadership roles who trusted that if it was me, then they're going to give it a try.
Great. I love that. So can you kind of, I would love to hear about your own experience with breast cancer. So
Oh
if
yeah,
we kind of travel along your
yeah,
timeline, so you were a family physician
yeah.
and you were practicing and then you had your own diagnosis.
Right.
And right,
And at
so
that
how was
time,
that?
I was 40, just turned 47. And
Mhm.
so I wasn't at an age where they were doing routine mammograms. As far as I know, I didn't have any family history of breast cancer. So I found a lump one day. And so I walked myself in and said, I need a mammogram. And so they said, oh, well, you can book it. I said, no, I need it right now. And so then once I had that, they wouldn't let me leave because though we could feel it, they couldn't see it. And so then they did all kinds of other tests, including dye tests and all this. And eventually he said, oh, I have a bit of extra time. Tell you what, I'll do a biopsy right now. And I said, oh, that's nice of you. Thank you. Not thinking that's not a good idea. That's not a good sign. Um,
Mm.
and so they rushed it, and it came back. I saw a surgeon, and it came back positive. And then he said, because we can't see very well, I need you to do an MRI, which was not very common back then, which was 14
Mm.
years ago. And then they found another growth in the other breast. And so that's when they said, you know, and then they did a biopsy of that one, and that came back with cancer as well. So
Mm.
then they said, well, we should do a bilateral mastectomy, and tell you what, we'll do reconstruction at the same time, which is the first time they'd ever done it at Oakville. Um, and it was really, really successful. And then I went on, of course, to have chemotherapy, and then some. There's a trigger that when you have bilateral different cancers,
Mm.
you are eligible for genetic screening, and it came back that I was BRCA positive, BRCA1. And then my cousin got tested who had ovarian cancer, and she had the same one. So then we realized it was through my father, and that's how it wasn't really obvious. And then
Oh,
he found that his mother had died of ovarian cancer, and all her sisters had. So it was all ovarian cancer. So of course, once chemotherapy finished in 5 months, then I had to have a hysterectomy before I could get back to work. And my locum was needing to go. That's someone who fills in for you. And
Okay.
so I went back to work pretty drained. And it was very interesting because when I went back to work, here's me, strong, strong, strong,
Yeah.
I can, get the last place in emergency medicine. But I was so weak and vulnerable. I called myself fragile. I felt like if anything went wrong, I was gonna just crumble. And I thought, this is so weird. Why is this like this? And that's when I got interested in psychotherapy. And that's when I went to art therapy. And it turns out that's really a grief. You don't realize the grief of and loss of your vulnerability, the fact that you are mortal. And when you face a death like that, and you come so close, that there is a grieving process to that. And it made me slow down and really understand psychotherapy. And I think that really changed my trajectory, both with patients and myself. Yeah.
Wow. So how did it change with patients? How?
Well, the ability to now understand and be compassionate about loss and how we are fragile, vulnerable people, helped me to sort of open people up by being vulnerable myself. Not exactly sharing. You don't need to do that. You just need to be able to reflect the emotions that someone's feeling with deep understanding and authenticity. And it's that really that now I practice, is just a very authentic person. And I always said that glass wall we were taught of doctor on one side and patient on the other broke down in cancer. And I was sitting on their side, it was so different. Yeah.
That's so beautiful.
Yeah.
Yeah. And then for you, Dr. Ginty, like how, I mean, obviously, yeah, you were feeling fragile and what was happening at home with your family, like learning now that this BRCA gene is there, and that's pretty daunting as well for future
That's the
generations,
thing.
right?
Yeah, that's the thing
Yeah.
with genetic high risk mutations. Is it's not just affecting me, which was, of course, having to have the hysterectomy, dealing with a sudden menopause and an anti-estrogen medication, which was really kind of like, whoa, all of a sudden. But it was also what I call the fallout. It was the fallout of this diagnosis, where that rolling fallout of problems starts to affect everyone else. They weren't just worried I was going to die. Now they're worried that they are carrying the risk of dying too. So, I had to take my sister through it, and my brother and my own kids. I had to manage them through it. And all of this I was very open about. And it's interesting because you'd think also that the sadness comes with a diagnosis of carrying the mutation, but there is also a guilt of not carrying it, the fact that they're freed and you're not. So it's all very emotional, but
Wow.
it was actually very hard. And then there's a lot of other cancers that you're monitored for when you carry an abnormal gene. So that was also something that you just wanted to put behind you, but you can't. So
Yeah.
yeah, that I didn't. That's really upsetting as well.
Yeah.
It's a big fallout. Yeah, yeah,
Yeah, for sure. My
yeah.
goodness. So when did the tattooing idea, like how, tell me, like how did this come to
Yeah, that's a really
mind?
interesting
Like,
story, really, because
yeah.
I for years had assisted my husband, a surgeon,
Yeah.
orthopedics. So, but various things happened. You know, I've got all this arthritis from probably from the drugs I had to take and the chemotherapy and all that. Anyway, I've got all this inflammatory arthritis, and the orthopedic assisting orthopedics was heavy. It was hard work, and one day I said, "This is too hard for me." So I thought, oh, that's the end of it. But my husband said, you know, have you looked down the other corridor? In plastic surgery, they just sit down, you know. And and so I said,
That's
I
great.
could do that. I could do that. That would be really great. And no, loving anatomy. I love anatomy. And actually, there's really only the two surgeries that are really open, and one of them is plastic surgery and one of them is orthopedics. So I thought, you know, I'd love that. And while I was assisting, one of the plastic surgeons who does breast reconstruction needed an assistant. And so I thought, oh, okay, I'll try it. And that was it. I loved this. I loved it. It was creativity to its best. And I absolutely loved this. So that was it. I was hooked of always being her assistant. That was years ago. And then when we did some of the surgeries that included taking cancer out, the surgeon would say, that looks great, but if only there was a tattoo on it. Well, you see, you can get tattoos. They do train in the permanent makeup world and body art world of tattooing, but they're very expensive. For a good one, they're very expensive. And me coming from Cancer Care Ontario, you know, equity is one of our main standpoints. You know,
Yeah.
everyone should have access to the same thing. And I really authentically stand by that, actually. So I was thinking about this, and I knew that there was an OHIP code for it. So I call OHIP and say, is it a specialist code? They said no. So I said, so I could build that. And they said, yes, you could. So, but of course, being a perfectionist, I'm not going to do it any old way. I'm going to be the best. So I had to find someone who's willing to train me. And so I got someone who trained me quite well. And then I thought, you know, I want to be the best. So I want to find someone even better. So I looked at my inks and I thought, okay, who made these inks? And it was a specialist. And so I convinced her to take me on, which is no easy task, believe me. And so, yeah, she took me on hardcore, man, hardcore. Like, you know, you are slapped around if you're not doing it right, you know. So, but it's okay. I'm okay with hardcore. And honestly, the other thing that she was really, really strict with was drawing. You have to draw and draw and draw. You have to draw realistic life drawings of everything. And she would make you draw all the time. And then we had to post on Facebook for weeks and weeks and weeks. And so drawing was very, very important, getting the folds right, getting, you know, shading right, all of these things. And then taking that to your tattooing, because tattooing is just another medium of art.
Yeah.
It's, if you have the concept of shading, it's just another medium. There is technique to it, but like with all art, there's technique. So
Right.
if you don't have the concept, it's useless. And I would really say art first. Art is first. So I went down to California, trained with her, and came back with even more. So now I'm even critical in my own self. And what I do is I actually continue to do life drawing and where you go to a studio, you do life drawing. And so you constantly are looking at shade, you're constantly looking at perspective. It's all realism. So what I'm doing is inking realism. And it's 3D tattoo is an understatement, really, because I mean, anything I really think the way you describe it is inked realism. So you want it to be so convincing that you want to touch it, and for someone to say there's no way. And sometimes when I'm looking at my photos, I'm going, is there a nipple there or not? I can't quite tell, and I have to look for. So even I get fooled on my photos. So that means it's good enough. It usually takes 2 or 3 goes. But
Yeah.
so it was really about thinking, could I do this? And then I vocalize that, that's me. I was thinking about this. And then someone would say, look, you're going to be amazing at this. I know you. You've got all the right formula. So I thought, yeah, I'm going to do it. I'm going to do it. And this is the funny thing, though, is there's a couple of funny stories, of course. So I take my little, I'm always looking, how do you build this? How do you do this? And one of my instructors said, well, when you go to different places, and I'm looking going, well, how do you go to different places? Like, how do you pack this stuff up? Oh,
Yeah.
you put it in a makeup trolley, like a little makeup trolley. So I thought, oh, okay. So here I order my rose gold, makeup trolley.
Yeah.
And so when I proposed this, I thought, oh, I'll just, call the family medicine, no answer. So off I trot to the admin office and say, how do I get hold of the person who runs outpatient, the outpatient department? Because my idea is a seamless journey for the patient in this hospital to go from having cancer to reconstruction to a restorative tattoo, and out they go with feeling complete again in the best way we can. It is not reproducing what they had, but in the best way we can. So they put me in touch with this person, and I book an appointment. Off I bring this little rose gold trolley in, all my silicone models, see, like all these little models I have here. And I lay them all on the table, and she's like, Alex, we've been waiting for someone like you.
Oh,
so what can we do? What can we do? What do you need? Well, if you're from any place like I come with leadership, the first thing you say is, I don't need a nurse. Oh, then I'm listening, because that means I cost you nothing. Okay, well, then I'm listening, because as long as there's no cost, then I just need a room, and that's it. And so then they said, well, you know what? It's a service, and everyone, I buy things for everyone. So I think we should just buy all your stuff as well. So here I have these beautiful guns, and needles. Yeah, needles go in here, and beautiful, anything I want here. And of course the mural, because you've got to make the room lovely, and anything I want. So now I have this permanent room here, and I cost them nothing. And I even had to call OHIP and say, when you build an areola tattoo, what's the timeline to billing it again? And they said, oh my gosh, no one's ever asked us that. I don't know. So, I mean, I'm really treading new ground here. And so they said, we asked around the office and no one knows. So just do the way you're supposed to. And so I said, oh, well, this is how you're supposed to do it, 8 weeks. So, okay, fine. And then, so that's basically what happened. Yeah. So it's
so that's, I wanted to ask you that, like, so the whole process that you do, I mean, besides, like you said, going and paying through the nose to a professional tattoo artist or whatever, there's nobody doing what you're doing.
No.
Like, No,
No,
and this is
this is
covered by,
universal
I
access.
was thinking too, anybody who's listening from the United States, OHIP is our Canadian
Mm,
coverage, like for,
Ontario
yeah,
Health Insurance Plan. Yeah.
yes, yeah, yeah, amazing. So, like, where do you see the future of this, Dr. Ginty? Will you train people
Yes.
to do this? Yeah,
Yes, along with the tattooist who started training me,
yeah,
who's really super. She's lovely, and she does a lot of training. So I want, this is what my vision now is.
yeah,
This
tell
is a
us.
reproducible. This is a reproducible concept.
Mhm.
And the way I manage it has worked amazingly well. I've tried a few different things. I started with a different program, but I love this one. JNAP. JNAP.
Oh,
I love JNAP. So
okay.
if JNAP's listening, I love JNAP. So JNAP is absolutely amazing for this, and I would reproduce this. We need to train people and put it in other hospitals so that we can have universal access. And it's going to be a seamless journey for people to have when they have cancer and they have to have a mastectomy. It is incredible grief. And don't forget that many of the people I see haven't just had a seamless journey like, well, I had chemo and all that, but many of them have had failures in their surgery,
Mhm.
in their reconstructive surgery. Many of them have had infections, or that the flap that we did that's been done died. It did, this blood supply died. So then they have to have something else done. So you can see the trauma people have been through, and that is where I come in. A lot of scars, sometimes unequal breast size because of what they've been through. And what I do is I put on this areola nipple complex that suddenly makes them whole again. And the emotion that pours out is unbelievable. It's just incredible. Like I hold them with that, you know,
Mhm.
and being comfortable holding people in that emotion as well is, it's emotion that's happy and sad and everything mixed together, and it's all about their trauma and their journey, and it all floods out when they see this completeness,
Mhm.
because no longer does your eye see the scars in the same way. It's amazing. You would be amazed how different your brain sees the breast, which is what you were born with. You know, that's what you've had
Mhm.
your whole life, and it got taken away. And it's so odd. If it was any other part of our body, we wouldn't think about it because it's under our clothes. We think that that's okay. It's not okay.
No, it's
It's
not.
not okay at all.
Yeah. I
This is about who you are, and it shows on your face. It, I even find that when I'm taking the photos afterwards, the person is straighter. They're more. It's
mm,
amazing because they just have this belonging and pride that
yeah.
comes with uh, their restoration. It's really
Wow.
amazing. Yeah.
Dr. Ginty, just along with this, I have a very specific question from one of the viewers, and I'd like to ask you now because I think it's kind of fitting with what we're talking about. Um, yeah, and then we can go into some more detail because you told me some pretty exciting stuff before we started that I want to touch on as well. But um, so she's asking, I have stage 2 breast cancer and it's in the lymph nodes. I've already completed surgery and now I'm starting chemo on April 18th, first 8 rounds and then 25 rounds of radiation.
Mhm.
Still Still considering double mastectomy with implants. However, they want me to decide before radiation and have surgery then. And now she's asking, from your experience, is this not a surgery she can have at any time? Does she have to decide now, I guess?
These are great conversations to have with your plastic surgeon, and it does bring up the individuality to everyone's journey. I think people always think, oh, I had cancer too, but everyone is so individual, and your choice of surgery will depend on so many things, including, radiation, including your own health. Could you go through a 10-hour surgery, which is a DIAP flap, which is very done very much more often now because it's natural tissue. It can be irradiated. I always say that radiation is it's hard on the skin, and it's hard on the tattooing as well. It's much harder to get the ink in there. You just have to do more visits, but that's okay. The surgeries are sometimes done afterwards so that you can replace that skin with your own natural skin if you're doing a flap, for example. So, and some people, gold standard, have their cancer taken out at the time of reconstruction, a bit like me, but sometimes it's actually a large flap. So everyone's a bit different, and so many factors come into that. So there isn't really an answer. It's an answer more along if I was to say from the tattooing point of view, tattooing's much easier on natural skin than irradiated skin. But and so is radiation on implants is hard. It can be hard on implants. It's hard on any vascular tissue, which is the point of it, so nothing grows.
Yeah.
But I think it really comes back to a conversation with your plastic surgeon and their team. And if you're not getting the kind of listening that you need, then you need to find someone who does give you those listening skills. Your primary doctor is a good resource as well, knowing your whole perspective. But also, I think there are some lovely supportive organizations like Canadian Cancer Society, who have volunteers who have been also through the cancer journey and can have a nice long chat with you as well, with some reflection. And there's some great Facebook groups as well that are monitored. You have to be careful, to have a well-monitored one, because otherwise it can be very, it can be the wrong kind of information. I have a website, and it's called Restore Me ABC, or restoremeafterbreastcancer.com. And we go through all the kinds of reconstruction, not what's best for you, but Dr. Willoughby does have a lot of really good videos of why you might choose one over the other. And it does help you put yourself in perspective. And I have done a lot of graphics that help you understand what's involved in the surgeries. So I think those might help you, but I can't answer your problem. Yeah, but those will help you.
Oh, that's so great. Thank you for that information. That's really great. So I wanted to ask you too, we were talking about the tattooing, and you were showing your forms and everything. And then you said that you're getting into veins.
Oh,
And
yes,
also,
I did.
along with that,
yes, I did.
I want to know about the veins.
That these look a little bit airbrushed. Yeah, like they are good. Okay, yes, they are good. They do look really real. There we are.
Yeah.
There we go. But they do look a bit airbrushed. I mean, I have some other examples here that are worse, I think, from they are more manufactured. But to make it look real, you really want to look at the skin. And if someone has a lot of these things called Montgomery glands, then you want to, you want to reproduce that, especially if you're doing unilateral, which is what I'm copying to the next one. That's where art really comes in. I got to try and copy the illusion. And that's the hardest, I would say, because if I have my choice, I like bilateral because I can do it the same. But you're now an artist if you have to copy. But the thing I particularly tried and I love is putting some veins in there, and you would be surprised how many little veins are in your skin and look so good in creating this and getting more creases and realism in there. That's what really makes it fool the brain. It really does make it fool the brain. Really getting texture into the nipple, getting the little hills and valleys. The nipple actually has a lot of little creases and irregularities, and they're all very individual. They're not round balls. They're not round balls. They will look weird if they're round balls. So that's what creates a really good one. And actually, Dr. Willoughby jokes that I'm the one always looking and trying to. You must be the only person who actually looks at nipples and areolas. And I'm like, I know, because I need to reproduce that with so much realism that you get fooled. Yeah.
Yeah. My God, that's so great. And another question is it painful? Like having it done, is it painful?
Great question. Really great question. We have, here we are, there's one here. So I used to use an injection, but you get these nasty hematomas. That's like a little blood clot under the skin because there are so many veins there. Some people who have a flap reconstruction have the blood vessels reconnected, but the nerves are not reconnected. So quite often the skin panel, which is the skin that comes with it, is numb. And that's easy. I can deal with the numb skin. But very commonly, people who've had any kind of reconstruction, even if it goes over the flap area, they'll feel it. So I have this gel. We developed this with the pharmacy. They already were using it in the Emerge for kids who didn't want to have needles. And once the skin is opened, so what I do is just a few little dots. You squeeze this gel onto the skin and it penetrates very, very quickly. It contains tetracaine, which we use as eye drops, which works in, seconds. So that's really how quickly this works. It really works well within easily 5 minutes. And you can see the white starting to happen with the epinephrine. So it's got two different painkillers and some epinephrine. And so it works beautifully. People who go ouch after 2 minutes or so are really going, yeah, it's good. Yeah.
Oh, that's great.
And so how many? Really nice.
Amazing. And how many times typically does someone have to come? Like, is it like another tattoo where, like, let's say I was getting a snake on my arm, you might do the head first.
Yeah.
Is it like that where it's in
officially,
stages?
Officially, people might say you do it in layers, but I do complete it. But I would say typically 3 times. Okay. 3 times I'll have people. It used to be 2, but I'm really not happy. I really get them back the 3rd time, and sometimes I won't do any more, but I like 3 times. If it's irradiated, for sure 3 times, probably 1 more. So that's how often, but it's much shorter. So the first time is, if it's bilateral, that's both sides, it's 2 hours, because we have to plan where we're going to put it. And then we template it. I call it template it, which means I kind of think about what kind of size we should have or match it to the one that's existing. And then I draw on the skin, and we kind of, it's not always like a big, like one circle that I splotch onto the skin. If you've got some weight to the breast, if you have a look at an areola, it has a bit of an oval to it, so it naturally hangs a little bit. So you want to recreate that shape, not just a splotch of round. It's got a little bit of ovalness to it, and you'll have a little bit of some weight to it with some creases and so on. So you have to again fool that brain a bit. So you match it, and then we choose the colors, which I've got a whole lot of inks here. So they tend to be in spectrums of skin tone, from fair to bronze to golden colors. And then you'll choose about 5 colors. So there'll be a shadow color, a highlight color, and then there'll be 1 or 2 nipple colors and 2 areola colors, because you'll see that the areola kind of, even though I dilute them as it goes away, it's a little bit darker towards as in the middle. And or redder. It's like the very fair, it's kind of pinky. And then people who have a darker color skin, it's just darker. And so you want to use more highlights and so on to try and get that 3D effect. So yeah, we choose the inks, and then it takes about an hour and a half to do the 2. And that pretty much is right on. And then 1.5 hours for 1. And then I cover it in these Tegaderm dressings, which is like a clear skin. Like this. It's a clear dressing. And so then people can shower the same day, whatever it's, and then they'll change that for 3 days and then leave it open. And that takes care of it quite nicely. And over about 2 weeks, it'll sort of become crusted, and then it reveals its color. And then I get them back 2 months later.
Okay, that's we just have a really good question from somebody asking. Lynn Pike is actually asking, do patients need a referral to get tattooing?
Yes. Yeah, and that's one of the ways I keep the costs to be reasonable, is I get a referral from the physician, and this way I can bill a consult. And that way what I do is I dictate on the hospital line a consult back to that physician, and we use it as a medical continuity of care and medical circle of care. So this is the whole trajectory that we want to keep. This is a medical restoration. This is not a tattoo like you might get in a tattoo parlor. This is very different, and that's what keeps us different. This is a restoration of a medical procedure, and that is very different than what we took away, we're putting back. That is not the same as adding. So it's very important that what we took away, we're putting back, and it's no different. That's why it's covered. So yes, if you look on my website on the nipple areola tab, there is a downloadable form, and any part of your medical team can sign that, including a nurse practitioner. So it can be your family doctor, it can be your oncologist, it can be your plastic surgeon. So, and then there's really obvious, it's faxed through an e-fax line, a secure e-fax line. And then what happens is I contact you usually by email and invite you to self-book. But I do keep tabs on who comes in, so that if I don't see you've self-booked, I'll give you a call.
Okay, that's perfect. So somebody who had, maybe went through their surgery 10 or 15 years ago and is interested in that, it doesn't matter. It's like,
doesn't matter.
They can come.
You can have reconstructive surgery. You can have nipple areola restoration at any point. 10 years later, 20 years later, there is no timeline.
Okay. Oh my God. So I have to ask you, have you had this done yourself? Like, have you had it?
Yes,
and was it your teacher who did it, or who did it for you?
This was a long time ago with someone who everyone knows, called Kyla Gooch. And she was the pioneer and best. Everyone knows when you see her tattoos that they are so realistic. And so she retired, and she was very expensive, I have to admit. But she used to present at something called BRA Day, or Breast Reconstruction Awareness Day. Everyone should be aware of that. BRA Day, if you Google BRA Day. And we have it once a year. And Kyla used to present at that. And I'm hoping that I can do some of that to make sure people are aware of how we can restore you back to a wholeness. I like to say that, a wholeness.
Yeah. And I'm just imagining, Dr. Ginty, like what a beautiful exchange it must be with
Yes.
you in that room, and you have your person there and you're helping them, and you've
Yes.
been through it yourself. Like it's got to be a really special space,
It
you know, like,
is. I do hug
yeah.
people. I do. We
Oh,
do all the time, because
I love it.
they are so grateful, grateful beyond,
Yeah.
because many of these people couldn't access the price of restorative areola tattooing. This
Right.
is not an add-on. This is putting back what was taken away. And it's sad to think that that's how it's been viewed. So I think bringing back this is I'm hoping a new wave, of finding this crack of what was needed and opening it wide and saying, we need this. This has been forgotten. Yeah.
Exact, just like the eclipse, right? Bring
Yeah.
on the light.
Yeah, that's right. Yes. Yes.
Yeah.
Yes.
So Allison Moore is chiming in. She wants to know what type of professionals can be trained to do this type of work, doctors and nurses, or yeah.
Well, you see, of course, nurses can be trained, but nurses have to be paid. So nurses are
Yeah.
employed, and that's very different. So nurse practitioners are employed, but the difference is with myself and in this tight medical funding, let's say,
Yeah.
that was the ticket to this, to turn up and say, I don't need funding. Hospitals are so tight with funding. They are canceling beds. They can't afford the nurses to manage the wards. They can't afford another nurse. So absolutely they can train. The trouble is it's difficult to fund them. So the independence of being able to use OHIP, use a consult, use OHIP, I absolutely love teams. I love them. The big problem is that the hospital can't fund another nurse in an area that is often forgotten, or at least not prioritized. I'm going to say that, not prioritized. So I'm beating through that by being able to use this code and a consult and say, we can do this and we can make it happen with universal equity. And using that approach is very attractive for the hospital community. But the difficulty is funding a healthcare professional who's not self-employed. Yeah.
Okay.
Yeah.
Wow. This is amazing. Like you're going to be worldwide, training
Well,
people
at
and
least Canada, because this
yeah.
is a way that we have funded Canada as a healthcare system. I don't know that all provinces have this as a code. It's not a new code. People say, oh, how did you get that? This has been around for decades. The plastic surgeons used to tattoo in the OR and put what we called a pepperoni, because I'm allowed to say that because a patient came with a pepperoni on them. And it looks like a pepperoni. And she says, I've come for my nipple part. And I'm like, what are you talking about? She's like, I've got the pepperoni. So I'm like, oh my gosh, we have to redo this. So they used to put the pepperoni on there and have no training. So the code has been around for decades, probably hasn't changed much either. But anyway, and of course, is it a specialist code? Anyone can use this code. But as family doctors, we don't expect a lot. I'm not expecting a lot. This is not
Mhm.
the fact that I have a room here without cost, and we're really minimizing admin costs, keeps this something that is reasonable for me to be
Mhm.
able to do. But it wouldn't be worthwhile for a plastic surgeon to do it. And why not have someone who's really good at it to do it? I mean, that
Yeah.
makes sense. I wish that nurses had the independence to be able to do this. This is just a crack that I've been able to successfully open. And
Mhm.
I think that it's a formula that would really work.
Yeah, I do too. And I am just so grateful. Like you spent a whole hour with us talking to us about this. And the more people who know about what it is you're doing, the more people are going to be advocating for this, that this
Mm,
is something we need. And I love the whole piece about, this is not we're putting back what we took away.
mm,
Like it's not an extra, and
yes.
that is a human
Yeah.
right for sure. Yeah. Dr. Ginty, thank you. This has been so amazing talking to you. I've really enjoyed it. Is there anything that we missed? Like, is there anything that
No,
um no, we covered
I
it all.
tell you, I'm so glad that people here are patients. I'm such an advocate of the patient and being the journey. I love
Yeah.
sharing the pictures with the patient. I love the patient self-booking so that they can move their. I think we should get away from the hierarchical system, and that's because I've been on both sides, and
Yeah.
that I think is where the new system needs to go, and I'm pushing that. Yeah.
Perfect. Do you mind giving everybody your website just one more
Oh,
time
yes,
before we
yes.
say?
So do look at that because it's just so informative. It's
Yeah.
restoremeabc.com. That's restoremeafterbreastcancer.com.
Okay.
Restoremeabc.com has everything you'll need, and you can contact me there easily.
Amazing. That's so awesome. So I'm going to just put you into the virtual green room again. I'm going to come right back to you, Dr. Ginty. Make sure you're okay, but I'm going to say goodbye to everybody and thank you so much. So
Thank
grateful.
you. Thank you.
Thank you guys so much for tuning in. What an amazing conversation. Wow, we need more Dr. Gintys in this world. Thanks for watching. Please check out our sponsors, brendabadome.com, scooters.ca, flourishandbasque.ca, and my website, glamjewels.com. Can't wait to see you back here next week with another amazing guest. Keep on showing the world your sparkle, and thanks for being here today. Have a great day.